Good evening, everyone. So, our next topic is from the subject of pathophysiology for e-content, and the topic name is gonorrhea. My name is Mrinal Roila, as an assistant professor in Regional College of Pharmacy, Jaipur. Okay, so what is gonorrhea? Gonorrhea is a sexually transmitted disease caused by the bacterium Neisseria gonorrhoeae. This disease has no symptom at all. Men may suffer have a burning micturition or discharge in penis. Women may have a burning micturition, vaginal discharge, and vaginal bleeding during the periods. Complications in women include pelvic inflammatory disease, and in men include inflammation of epididymitis. If untreated, gonorrhea can spread to the joints or the heart valves. Neisseria gonorrhoeae. Neisseria gonorrhoeae is a gram-negative bacteria which is a diplococcic bacteria isolated by Albert Neisser in 1987. It caused sexually transmitted genitourinary infection which is known as gonorrhea. You can clearly see the diagram of gram stains of gonococcal urethrae. And gonorrhea is isolated on a thymer agar in environment enriched with 3 to 7% carbon dioxide, and thymer agar is a chocolate-based agar plate heated in blood agar containing nutrition, microbacterials, vancomycin, colistin, niacin, and trimethoprim. If we come to the epidemiology of this, you can clearly see that countries like Africa and India suffers the most cases of gonorrhea. It says that in India, about 10 million cases are reported of gonorrhea, but in worldwide, it is 88 million. So, by the standard of world, we have about one-eighth of the world cases of gonorrhea. And in 2013, it was reported that around 32,000 deaths occur, which were more than 2,300 in 1990. Coming to the signs and symptoms, if we talk about female are mostly asymptomatic but may have vaginal discharge, lower abdomen pain, and pain during sexual intercourse associated with inflammation of uterine cervix. In men, it the symptoms have inflammation of penile urethra associated with a burning sensation during urination and discharge from the penis. Men and women both can acquire gonorrhea from the throat while performing oral sex or an infected partner, usually male partner. The incubation period is about 2 to 14 days, with most of the symptoms appearing between 4 to 6 days after the infection. Gonorrhea is associated with the increased risk of prostate cancer. So you can see that gonorrhea is mostly occurring in men, men patients. Coming to the etiology or the causes, it is mainly caused by the bacterium known as Neisseria gonorrhea, while the mode of transmission can be through vaginal, oral, or anal sex. Men have a 20% risk of more getting the gonorrhea during and sexual intercourse, while women have a 60 to 80% risk of getting infected during a vaginal intercourse. A mother may transmit gonorrhea to her newborn child during childbirth while affecting its infant height. It is referred to as ophthalmia neonatal. You can clearly see the photograph in which a child have shut eyelids and there is an infection around the eyelids. This infection can spread via contaminated fluids, and the bacteria typically does not survive outside for longer time. Here's the pathophysiology, which is the main topic we have to cover. First step is the adherence of gonorrhea to the urogenital epithelium. Second step is the competition with resident microbiota, nutrient acquisition, and microcolony formation. So what happens is that gonorrhea bacteria multiplies itself. In third step, the bacteria releases the peptidoglycans, LOS, and OVMs. In fourth step, the cytokines and chemokines inflammatory mediators are released, and these inflammatory mediators react with the peptidoglycan and LOS, which forms infiltration of macrophages and epithelial cell. In the sixth step, there is an influx of neutrophils, adherence of phagocytosis and gonorrhea, and in the seventh step, the neutrophil-rich plurulent exudate facilitate transmission. So you can see that the bacteria attaches to the urogenital area and an inflammatory response occurs which results in more infiltration of bacteria. Here's another diagram which shows the pathway of the N gonorrhea. We don't have to discuss this pathway because it's just a similar pathway, but it shows that what are the immunosuppressive immunomediators that are occurring like interleukin 10, PDL1, and tumor growth factor beta. Coming to the signs and symptoms of the patient, in men, the incubation period is 1 to 14 days, while in women it is also similar. But the symptoms occur in 2 to 8 days, while in women the symptom occurs in 10th day. The site of infection for men is urethra, while for women is endocervical canal. Symptoms is usually asymptomatic, but in men it can be urethral infection, anorectal infection, and pharyngeal infection, which is the infection of your throat. While in women it is endocervical infection, urethral infection, anorectal, pharyngeal infection, and the signs include discharge from the urethra for both men and women. Complications are usually rare in men, which can result in prostatic cancer, but in women it results in pelvic inflammatory diseases. How can we diagnose this? Since it is occurring by a bacteria, the diagnosis is also based on a bacterial staining and culture, like PCR-based testing. PCR means polymerase chain reaction testing, which can significantly increase the bacteria size that can be located on the gel electrophoresis. The sample for the PCR is taken from the urine, urethral swabs, or vaginal cervical swabs. Next topic is how do we prevent? Since it is a sexually transmitted disease, the use of contraceptives is usually recommended, like as condoms or other protective gear. For those who are previously infected, a follow-up checkup must be maintained with the doctor or a clinician. Newborn babies coming through the birth canal are given erythromycin ointment in eyes to prevent blindness from the infection, and gonorrhea should be treated accordingly. Last topic is the treatment. Treatment includes typical regimen of antibiotics, which includes ceftriaxone, azithromycin, cefixime, and your cefotaxime. So you can see since it is a gram-negative bacteria, most of the antibiotics that are used are cephalosporins or your aminoglycosides. For children with an eye infection, we only use ophthalmic drops of erythromycin and a tablet of ceftriaxone, injection of ceftriaxone, which should not exceed 125 mg. For complicated gonorrhea, we usually consider ceftriaxone 1 gram IM, and for uncomplicated gonorrhea infection, the dose is lower for ceftriaxone with a combination of azithromycin, cefixime, and consultation with the disease expert. So, in conclusion, gonorrhea is a gonorrhea is a sexually transmitted disease that is usually caused during sexual intercourse, and it can be transmitted to the fetus, and the pathophysiology includes the typical bacterial life stage, like the first bacteria will attach to the surface of your uroepithelium, then it will multiply itself, then uh, the body will form inflammatory mediators, and then bacteria will infiltrate neutrophils, and then blah blah blah. Nobody is reading this. So, thank you very much. I conclude this video. Thank you.